Okay, okay. Thank you for attending today's webinar. Today's webinar topic is AI disturbing healthcare. And basically, we are going to talk about what is the AI in their role in healthcare and what the current challenges. And then we have a special distinguished speaker about what is the struggle means the silence crisis and how Web3 could save the day. So, our this speaker, the Brigitte Piniewski, she is a very special that I'm going to explain why. But first, I'll go over what is meant by AI in healthcare, and then I set the stage, and then she will give her insight, and then maybe this session will be more interactive. So whoever have any comment and question, and then maybe during the her talk, you can maybe make your question or the comment in first in the chat, and then I'll look at it, and then maybe have an interaction between the speaker and audience. Okay. Okay, so first I will touch over AI in healthcare. So basically I'm an expert in AI in healthcare. So I did a lot of the this kind of event before that I explain later. And then I summarize what I've done up to now and my experience for the AI in healthcare. So why AI in healthcare? So usually the how they can be the contribute to the AI for the healthcare revolution. So I'm going to explain what is healthcare ecosystem and then what is challenge of the ecosystem, general healthcare, and then what is the potential of AI. And particularly recently, a lot of people are interested in like a ChatGPT type generative AI large language model. And then I'm going to talk about the particularly AI is a key technology, the powerhouse for digital health. So I spent 1 year to study the research over the whole ecosystem of the digital health in relation to healthcare ecosystem and how AI can apply in each sector. So I briefly go over that. And then particularly, I mean, I'm gonna share my insight because not just in healthcare, I've been in 30 years experience in high tech. So all aspect of technology industry I explore. So I wanna make some my from my experience, some tip how to innovate AI healthcare applications, just a fundamental level touch. And then maybe the relate to today's the main topic, blockchain powers Web3, whether they can be the solution for the challenges for the AI in healthcare. So how they can enhance AI enhancement and then decentralized AI and what the current is trend. So first look at the healthcare ecosystem and you know that the who is the key players, right? Stakeholders. And there are patient and usually called patient-centered healthcare. Everybody talk about it. And service providers, you know, that the medical professionals and the care institution or the care like a clinic, hospital, something like that, and payers. In particular, this is somewhat different from other industry ecosystem, is that there is the payment is done by these payers, so usually you know about insurance company, reimbursement, and other employers and supporting industry, like product suppliers, pharmaceutical, medical technology, devices, and health IT and research organization can support whole ecosystem. And what is the goal of this ecosystem, right? So we provide what kind of healthcare service to the patient, the people. So basically, we know about access, right? Equity and equal equity. There is a dream to everybody can access to high quality, so high quality service at low cost, affordable. So So there are many solutions we can handle that, how we can make the better access, low cost, high quality. And then with respect to this view, that we can think about how AI can contribute to these challenges in healthcare ecosystem. So I summarize everything, but I will summarize in here that also like a large language model can contribute to many aspects of the healthcare, but I go directly that I've seen. This is the one I draw the picture. So to understand the current status of this digital health with respect to traditional healthcare ecosystem, actually I researched it over like a whole ecosystem players. Particularly, I was interested in the startups. So I look at the like what the key players with respect to the some every sector of the healthcare. So you can think about is to like diagnostics, and then digital therapeutics, remote patient monitoring, and telemedicine, home care, and some clinical trial, drug discovery, that you have construed this ecosystem. So basically that whenever somebody asks me, what is AI in healthcare? Actually, the AI in healthcare, I can provide some good example is that because, for example, to care the patient, what the medical practitioners and then hospital do for you, right? First, they know about your health condition. So they just assess your health condition and then screening your whether you're diagnosed, whether you're disease or not. And then whether it's they to make clear that whether you actually have a disease or disorders. So medical diagnostics and the part they contribute. And then once they figure out what's the problem with the health, and then what you need is a treatment. So the in a T-star way is a T-star therapeutics ecosystem. Usually is the early stage, but is there are I found that there are a lot of the activities globally, and then once you have a treatment, actually the how you actually the prevent to like for example rehospitalization or even before you're infected by some disease, they want to be prevent. So they want to know about your health conditions, so remote patient monitoring or other like a monitoring device to, or like sensors, wearable device can sensing yours, right? And then even in the hospital, they want to be access to any place. So usually the people are very comfortable at home. So usually they call hospital at home or home care. And then this can be enabled by digital technology, especially AI. And then in the supporting industry, then maybe the clinical trial required to prove a safety and efficacy of your treatment, drugs, and then so like you need to find out a new drug for the treatment, and then provide a medical device to the hospital to make you like a treatment easier. Whole this ecosystem powered by AI, right? So I cannot imagine that digital health can be enabled without AI. So this is a whole scope that you can think about AI in healthcare. And then this is a fundamental thing that because I have seen recently that for example, I have a very active in LinkedIn, and then I see that through my, for example, I have a nearly 2,000 like new the like a connection in healthcare area, and many of them claim that they are working in the AI in healthcare, and then provide many different type of the good like insight over there. But I could not find that the fundamental level, right? If you think about, oh, okay, so in my concerning some problem task or whatever, I want to apply AI, then what is the fundamental thing you need to think about it, right? It's AI is not everything. They cannot do, okay, they can do no, they cannot do everything, right? Because there should be some limitation and challenges, right? So fundamental understanding of the AI as a function is very important, right? So why we call intelligence, right? So they can be mimicked to human intelligence, right? but they have limited intelligence. So when you think about what kind of AI function can be applied to healthcare, then this is a fundamental five function. Then you can have in mind the recognition, right? AI recognition function is enable machine to perceive, understand the world, right? Understand your health condition, identify patterns, interpreting data, and interacting meaningfully with their environment. So this recognition function is one part you can have in mind. That so I give you some example in the healthcare, like image recognition. You know about the radiology, voice recognition. So for example, voice digital marker can like figure out whether you have some problem with the mental health and Alzheimer, whatever, right? Emotion recognition, mood recognition, context recognition is one. And another thing is a prediction, right? They can predict something. They can predict whether there will your symptom will reappear or what kind of the new disease will be affected, whatever, right? So they can provide a preventive way to dealing with your health conditions. So prediction is another way. So they can tendency, preference, or context prediction they enable. And automation is automation. You can think about like automation is to like, for example, healthcare workflow, like when you go to hospital and they already just set up the workflow in operation in the hospital, they can be automated by this AI, and you can think about automatic way to do many things, right? And then communication, right? You know about the chatbot and then communication can be through the half by this AI and generation, right? For new drug discovery type, right? Because they can contribute generation. So these five fundamental function you have in mind that and then whenever you have your problem, you want to solve something, your task, then think about this fundamental function and then what kind of function you want to apply. This is a fundamental step you need to think about it. And another thing is that more technical specifically that once you have figured out the function, then you want to actually implement. And then actually implementing means that you need to know about the technical detail. So for me, I was very curious about that, whether make a unified view, like some framework that whether you can select choose some best option for usually the machine learning, like deep learning, whatever, that based on your application, then this is the basic algorithm function. So classify, cluster, forecast, image video analyzer, text analyzer, probability estimation is a fundamental algorithm you can pick and choose. So I provide for you that I look at intensively all kind of like algorithm whatever in the world now. And then I provide a summary. I also provide very detail in the appendix. So I already post my this presentation in my LinkedIn, so you can look at it later. And then quickly, so well done, right? Because AI can do a lot of things for healthcare, right? But they have some limitation and challenge. You maybe already heard about like a data limitation, privacy, security measure, and then usually, oh, yesterday actually, I have seen that one of the digital health group, the website actually to try to like request connect. I like her catchphrase was that AI can do a lot of things, but why they have a limitation? One is data. And second is expertise both in the technology and healthcare, right? So one is data related and one is the like a professional like expertise knowledge related, right? And then she also like she looking for someone actually have view of the mind and then improve something, innovation, something. I like that one, right? So limitation is data, right? You know about bias and a lot of the incomplete data. To get the like data, there is a privacy security problem, the sharing, exchange, a lot of problem, right? So AI depending on high quality data. So to make situation make better, we need some way to deliver these challenges and limitation. And another is for example, that AI is a centralized one, and then their computing power is limited, and then we have all kind of like a trusty problem. right? So we need to be more like a better way to do some AI to functioning, right? Because they call it decentralized. So the AI is not decentralized, but it's decentralized everywhere. They can provide, for example, federated learning is one of the traditional methods of doing that. And then for example, recently, actually, last week I attended and I organized some session about the related topic, but there was one focus that I found is MIT professor talk about the AI project, global orchestration of decentralized AI, and then he explained a lot of things, but mostly that I'm interested in was that the implementation part. So actually, they have a very practical implementation. Have in mind that they're actually launching this one to making operate. So their thing that maybe the relevance that they were looking for the tackle is that what is the best treatment for my patient. So if you put it in the word, right? And what is the best treatment for my patient? And you have it, and you want to need a recommendation, suggestion, whatever, and then their system provides some best options. So I just fascinated by this idea. Okay, so I give you everything. And then you see that all my talk is actually that I have done some maybe I'm going to do, but you see that even the EHR, integrated practical care and DTX, and then for example, they can in the healthcare revolution and even the digital twins and then other mental health, and I've done like the technology convergence with other for digital health revolution. And then this is the one I'm going to do next week, even the clinical trials, precision drug discovery. And then finally, recently I'm interested in the how to make digital health a mainstream healthcare. Then I can make a product assessments to provide the best option for the doctors and then integrate the healthcare system workflow that I'm currently working on. And I'm going to file a patent like this one tomorrow. But anyway, it's a good news but still, with this kind of good thing with the AI powered healthcare that we have some limitation challenge. And so today's talk, the main talk will be Brigitte. The why she's special them is because when I approached her, my intention was that I was very serious about to none of the disco, right? Because I know about, because for example, the Web3, I've been Web3 for 10 years, more than 10 years. I've done a lot of the different things for Web3. I know about the technology, everything, their killer application, everything. When I come to the healthcare, I was very serious about what's that. Okay, so whatever I experienced for 30 years, that to be a mainstream technology, enabling technology for specific industry, they should be core, included in the core part. And then I think about it, explain that. What is the core of the healthcare? Patient doctors interaction, right? And everything is a supporting, right? Other part is supporting, like patient doctor interact. For what? To deliver best healthcare to their people, patient, right? So in any technology, digital health technology, I know about it, not just AI. There are a lot of the like big data, IoT, and then extended reality, whatever, right? They should be touch upon that interface, right? And then I try to find the expert because is there any expert actually that have think about that space, right? And then even the last week, there are a lot of the topic, but there was a mostly fundamental level, infrastructure level, how to handle the data, privacy, whatever. But we only touch hope actually the fortunately I have some expert. They're not expert in Web3, but they have to think about having save in mind. And we have some one panel discussion about touch on whether Web3 can be contribute to mental health care. So this is the first time actually that I've looked at seeing that the Web3 to touch upon care, right? Care part, right? Not infrastructure, data, AI, training, whatever, care part, right? And then fortunately, I found Brigitte, right? He's a practicing, yeah, medical professional, right? She understands patient. He has over like several decades of experience, and even is to have a mindset of how to apply Web3 and AI like a perfectly to like maybe remove some kind of like handling this kind of limitation challenges, right? That's why that today's will be very special. Then I doubt I bet that I intensely search over the globally the expert have in mind this kind of set. I think that Brigitte is unique. So I pass over to Brigitte. Let's see her insight. And then this section will be more interactive. So whatever you wanna like have a share with her, whether you think like a comment or the question, it's a good opportunity for you to discuss with you. Okay, so Brigitte, it's your turn.
Thank you so much, Alex. Hope and welcome everyone. I appreciate the preamble. Certainly, listening to you and looking at your slides, it looks like AI is pixie dust. You can sprinkle it on everything in healthcare and everything will improve. Um, just a quick introduction regarding myself. As Alex mentioned, I'm a physician, spent many decades in primary care with obstetrics, so did a ton of deliveries, assumed that if we just did those 9 months of pregnancy correctly, we would be launching our babies off to 100 years of good health. Clearly, that's not true. And what we're really facing today in our modern world is the ability of technology to advance at a pace at which our biology cannot keep up with. And so conditions are on the ground changing so dramatically that we are seeing younger and younger cohorts suffering pathology for which medicine is far too inaccurate to provide any benefit. And so I think that's what really hits us as practitioners in this space is the realization that we're working in an industry in which the intelligence is just such a fraction of what it could be. And now that everyone is being exposed to the benefits of AI, what exists on the horizon is a very different future. But of course, taking advantage of this very different future will require us to think about our environments from a data perspective in a very different way. So I think that it's important to think that and understand that AI is shining a big light on the fact that healthcare intelligence is very limited today, that we have basically what we could call low contextual intelligence. We have disease management data and billing data. We really have nothing in the way of true health expression data, the information that we would be able to digitize around how our movement, our sleep, our nutrition, our socialization, our ability to engage with, various toxins, microplastics, etc. All of this is something that AI would have no trouble managing a plethora of details about us. But we as physicians, we don't understand our patients to a plethora of details. A tiny handful of variables make us provide a prescription based on, your age, your gender, your presenting symptoms, and therefore you qualify for X prescription. And so I think that we're at the cusp of this opportunity. There's a huge ability to move us away from suboptimal care to much more specialized and individually based intelligence. So just in quick introduction, I spent some time during COVID to write the book Wealthcare, Demystifying Web3 and the Rise of Personal Data Economies, with the hope to provide a long form narrative because so many people in our industry, specifically in healthcare, seem to be shying away from Web3, from blockchain, from crypto, because the assumption is this is relevant for finance and other industries, but not such, does not carry a lot of relevance for healthcare. And so during the writing of the book, I tried to introduce as many use cases as possible to provide insights into individual families and individual lives and how they look today in our current healthcare system and how they could look in a world in which the intelligence was way more specific and available in time for individuals to make a difference. I can offer an example that most people are aware of. Think of Steve Jobs. Steve Jobs succumbed to pancreatic cancer at a time in his life when he had no insight that this was an opportunity for him. And the interesting thing about pancreatic cancer, of course, is like many devastating diagnoses, we can't really blame our parents. The vast majority of these are sporadic cases, which means something happened on his watch that he wasn't aware of. And clearly, he had good access to optimal health care. But at the end of the day, he lived his life the way many of us are living our lives today. We live blindly. We hope we don't get ill, and we hope that if we do get ill, healthcare will be there to protect us. But clearly, that's not working out for many of us. And increasingly, more and more younger folks are suffering an early cancer diagnosis. And this is something that we can clearly make a difference with a better intelligence system. In the book, I talk about a three-zone model where this gives us an opportunity to track the minutia of our lives in zone one. So think of zone one as your home base, a safe and secure location to drop, your movement, your nutrition, your sleep, your device data, and convert our physical, that ebb and flow of our health expression, because we're all physical first, and AI is unable to manage any data that isn't in zeros and ones. So we need to convert our physical health expression into zeros and ones using apps and wearables. And that's something we would harvest and hold on to in zone one. Then the important part is zone two, which is a continuous non-rivalrous AI that is correlations only. So not a recommendation engine, but just a transparency engine, so that at all times we can see what seems to track with what. Imagine if an AI had access to, a few 100,000 variables about Steve Jobs and the other 60,000 people a year that get pancreatic cancer. It would have no trouble differentiating between the cohort that did get pancreatic cancer versus the cohort that did not, and what were the things correlated with that ultimate outcome at the end of the day. And so that is why zone two is a continuous correlations AI only, transparency. You take those insights delivered by zone two to your health professional and work on what is going to be specific recommendations for yourself. And then finally, zone three is that commercial layer. So everybody else that's interested in your data, governments, researchers, industry, and others, who have good access to pre-licensed insights from zone two, but don't have the ability to get all the way down to zone one where Alex's details reside. And in this three-zone model, we have an opportunity to provide protection at an individual level to the individual participant, but yet allow the insights to surface in a timely manner such that both industry and individuals and communities can take advantage of what is knowable at the moment that it is knowable. Did you want to ask any specific questions, Alex?
No, actually, you can go ahead, and then we have several questions, but you can yeah back to this question after your final talk. Yep.
Oh, okay, great. Just to highlight the fact that, everybody on this call, we all have the same thresholds today for many laboratory values, such as, our lipid levels. Yet that has nothing to do with what's optimal for anybody on the call. It just has to do with whether or not I can provide a prescription for you today. So we are in this world where our health intelligence that we're using today still relies on population data. And population data means that at the end of the day, the vast majority of us should expect an average outcome. But yet none of us exists as a population, and nobody wants an average outcome, especially if they're faced with a devastating diagnosis like pancreatic cancer. And so that's what the future aspirations are hold for us, an opportunity to get beyond delivering or peddling average to our patients, but actually getting to a place where the individual outlier experiences can be documented to such level of details that we could pass on to the next individual what would it take to get an outlier experience, and allow each of us as community members to share what is reachable for us such that we can define what's reachable for each other. Rather than all of us having the same thresholds for our lipid levels, we could deliver what would be an optimal level for Alex at this time, at this stage of his life, in this location that he finds himself living. And so that we would move into a future of highly personalized health that is informed by cohorts that have similar properties to yourself. Um, Happy to have this be more interactive.
Okay. I think that there are several questions. So, Jim, why don't you ask your question to her?
Sure. So I'm not directly in healthcare anymore, I'll call it the value chain side of it.
Mhm.
Um, but I have worked on, I'll call it the social side of healthcare before, um, in the past quite a bit. And one of the things we see, and this is a general observation. I'm sure everybody here on the call knows more of the detail than I do, but there are certain areas of healthcare in the US where, in a sense, our level of health has declined as we go forward in time for whatever reason, many reasons, whatever they are, environment, behavior, whatever. One of the factors is social behavior as part of your healthcare, social responsibility, accountability for your health, all that, and education, knowledge, all of those factors influence social behavior. And I didn't know if there was any detailed studies on, I'll call it successes and failures of, I'll call it social behaviors in healthcare solutions specifically. And I'm looking at the social side. So, not looking at all at medicines, nothing to do with financial investments as itself, moving away from all of that, just focusing on, I'll call it social behaviors, successes and failures in healthcare.
Yeah, and you bring up a really important point, Jim, and which I focus on in the beginning part of my book to really highlight the medical necessity of moving to much better intelligence. Because, like I said, historically, we thought that it would take 4 decades of suboptimal social, nutritional, movement behavior to give you diabetes, heart disease, stroke. But what we're seeing now with younger cohorts, the kids that are just going through puberty, we're talking not 4 decades, but really 4 years of a hormonally altered puberty that is the cumulative sum of everything that's going on, their movement, their lack of access to whole foods, socialization, being on screens all day. We're seeing that kids in just 4 years of a hormonally altered puberty are walking into very early onset diabetes, heart disease, stroke, for which none of us have the ability to offer them a second chance to go through puberty a second time. Whereas older generations just went into puberty one end and out the other and never thought about it, and yet seem to have good access to their genetic potential. And so this really highlights how, none of us are any longer accidentally well, is the way I describe it. Older populations, their parents didn't have to know how to feed them, how to socialize them, how to
Yes.
move them, didn't manage their sleep, and
Right.
they seem to come out the other end okay. Versus now, we have to engineer in, the environmental influences, of which socialization is a really important influence as well.
Right. And so I would argue I'm the oldest human left alive that I know. By far, that's what I tell my grandkids. You can bring me to class as an example. I'll talk about my pet dinosaur.
Mhm.
But you're right that I'll say a long time ago when I was a kid, a million years ago, you're right. We were accidentally healthy based on two things. We didn't have knowledge, and there wasn't significant what I call medical solutions to a lot of problems. But despite our lack of knowledge and the lack of, I'll call it better medicine in those days, we were what I call accidentally healthier in a lot of ways, mostly based on social behaviors. And so
Right.
the key to me when I have worked in the past with any population was saying, look, I would always start out and say, look, there's only two words that matter in the dictionary. The rest are sort of there for fluff. You need to understand expectations and consequences in any situation you're ever in, period. And if you can understand that for yourself and sort of the community that you're involved in at the time, you have a good chance of success. If you don't, you're probably in trouble. And so, to your point, when you look at the complexity of, in a sense, you brought up the example of, in a sense, people going through, I'll call it transgender medical changes. And I'm familiar with people doing that. You're right about not only high risk, but just overall the incredible challenges that exist in the environment today that did not exist to the same level 75 years ago, for sure. And so, to be great and say, hey, let's look at all the good things that's happening in healthcare, which there's a lot to be proud of and a lot to look at. As advances in technology, which we're celebrating here, which is great. The reality is that the challenges, not just in the environment, but also socially, our level of knowledge broader, not the people on the call, but in a sense, to your point, people who are stuck in what I call very severe life situations who don't have the knowledge, the education, or the understanding, or even I'll call it the social skills to manage more effectively their own path forward, which is really a huge area of challenge, which I don't, and maybe it's just me, I don't see a lot of, I'll call it industry focus on that at all.
Yeah, and I think that this is an area where AI is going to make a huge difference, right? To your point that we are very diverse and our problems are very diverse and our challenges are, and yet we as healthcare, as I just mentioned, we treat everybody like a population, as if we're all the same. We provide really blunt recommendations, we'll have a prudent diet and exercise regularly. That's not helpful for the vast majority of people that are handed that recommendation. AI could take some look at you if Jim AI understood you to a multitude of parameters, be able to say, okay, you're interested in losing 20 pounds. Here are a couple of podcasts you should listen to first, and then I'll get you to watch these 3 movies to get your headspace in the right space to move in the direction of losing this 20-pound mass that you're interested in. And then you're not much of an exerciser, so we'll focus on diet. Here are the things that you like and don't like. And here's a prescription that's specific to dietary interventions that will work for you. And oh, by the way, based on your cohort and your geography and other parameters about you, Jim, this 20 pounds is going to take at a minimum of 12 months. If we adhere to tracks 1, 2, or 3, pick your track. We can shorten the duration of this effort if you pick a more intense or a less intense track. And so
Actually,
to
yeah,
give
so
you
that's
some idea of the level of specificity that we could expect in the future.
right. So exactly following that, I created an exercise program called Gymchi with the idea that it's not a standard program. It's customized exactly to what you're doing. So there is no standard solution. There is no standard path forward. It's here's a problem set to your point, and let's do an evaluation of where you're coming from. And then from those two inputs, let's figure out what is the right program forward for you uniquely, different than somebody else. And that seems to, I'll call it, have better, what I call traction with people, because it's not me saying, here's what I do to help me exercise better. It's no, let's tailor it to exactly where you're coming from and what your goals are.
So the challenge with what you're describing is we're still providing expert-based opinions about what people should be doing, rather than a future whereby we move away from expert opinion and just go from opinion-based decision making to data-driven decision making. And that would be
Well,
something that would be available as the cohort's size improves and the dimensionality of AI's understanding around that cohort also improves.
yes, you're right about the what I call the, I'll say in general, the math behind that model. But the key to it is you're right that you're actually just measuring data and feedback as quickly as you can to
Correct.
have what I call continual adjustment of the strategy and the recommendations. So if I tell you do this, and that turns out to be the wrong thing, by tomorrow we know that that wasn't helpful, so to speak, and we have the right data to say, hey, let's make a course correction and do something different. But you're right. There's a lot of, I'll call it biofeedback models now for that are useful from, I'll call it a data perspective, whether it be, a Fitbit watch or anything else that can give me that kind of feedback as an individual.
Okay, thank you, Jim. Randy, do you have any comment or question? Brigitte, can you see chat? Actually, the Randy talk about, if you look at it, one area where AI predictive analytics will eventually benefit everyone's healthcare. Can you see that? The
Yeah,
question?
sure. The question will be, how well will the healthcare shift integrate AI into medical fields and practices? Progress, always question, that's the human part. So, Randy, I think what you're touching on is this sort of slow churn of health practices and the fact that as an industry, we're clearly compensated for the service that we're delivering today. And the service that we're delivering today is not dependent upon improved intelligence, and it survives and exists with the current level of low intelligence that we're currently operating on. And I think that what we're going to see in the future is more and more industries will adopt AI in ways in which users, the citizenry, will start to migrate towards those services that have improved AI utilization and improved data practices. So think of a future whereby you have a home base where you keep the minutiae of your lives, and you're offered to have your labs done at service provider A or B, but only B puts your labs directly to your home base. Then individuals will start to select those service providers that work with them from a data perspective and a data structure that works well for them. So for instance, I cannot expect to use my data for economic benefit if I don't have the ability to utilize it according to my wishes and to participate in data marketplaces that I've decided to participate in. And asking for my data the way I do today, with our limited access, we act as visitors to our data in the current healthcare systems. So what we'll see in the future is more and more autonomy over the data that we produce and the data that we request from the clinics and hospitals and health services that we participate in. And that will put us in a place where our individual digital assets will become more useful. If we go back to the lipid example, for instance, if I just try to share my lipid levels, they're of no use to an agent or a marketplace unless they come with contextual data. So for instance, if I was able to move my HDL from 28 up to 88, that's again of no use unless the AI can understand, well, how much movement was associated with that? What were the nutritional parameters that provided for that improvement in HDL? And so using apps and devices to bring rich contextual data to your lab levels, for instance, will increase the value of that data for AI, for marketplaces, and for yourself as a digital asset that provides economic benefit to yourself. And so I think it'll be not a place where Web3 does any sort of massive transformation of the current healthcare system, but really where more and more products and services provide agency at the edges, and that the citizenry starts to take advantage of that agency at the edges, and eventually more and more of the health system is in a sense, required to adopt these new data practices in order to attract the rest of the citizenry to their services.
Okay, Ari, I think that you talk about some incentives. Actually, that's one I have in mind that actually I want to share with Brigitte about what her insight. I want to think about whether this kind of like so Web3 based AI can like disrupt traditional healthcare. What I mean is that I've seen particularly in healthcare the two different characteristics different from the other industry. One is a public characteristic. Is a healthcare is a public type, right? It's just not private. Actually, it's for every person to people to that I mentioned about the high quality care, low cost, and access, right? It's for the so it's a very characteristic, strong characteristic of the public-oriented type. And the other is the payer. It's a different structure that different from other, right? Because for example, in consumer electronics, whatever, there is a consumer and provide a direct contact, right? So the people, for example, when you try to innovate, provide a service product, they only care about is the customer, the people. But in here, that I've seen that, for example, this is just practical, like the environment that whenever I try to design, for example, whenever I try to design my webinar. I only care about who might be interested in, and then a lot of people like think about like who are the player, right? And then mostly the payer, right? For example, that the when I talk about innovation in DTX, the recently I focused on, and a lot of people are interested in whether a CMS can provide a code and then they can be reimbursed, right? Because everybody. So, like as the Web3 expert, you and me, that we whenever we talk about the Web3, we talk about token economics. So there is a new economic system is coming out. And then I just think of whether that this kind of like a way to like a change it with health economics, right? Because in health economics means that like a public type like a value sharing cross like reimbursement like payers create the domain, and then so usually the patient's actually very passive where everybody talk about patient centric actually the nobody patient actually in the center because they are huge asymmetry in knowledge and everything. And then actually they are not, we talk about patient centric, but actually the patient is totally excluded in the healthcare industry, right? So
Well,
yeah, I think that whether you're inside about whether we can change the situation based on this Web3, based on AI, I'm just very curious about this. Yeah.
yeah, I think you bring up a good point that tokenization and Web3 technologies provides a brand new design space for both the payers and the providers in healthcare. I think one way to think about this is right now we only have, a handful of mega companies transacting on our data. And what we see in the future, as each of us have access to our own home base, zone two, continuous correlation AI, we have a future whereby we expect there to be a massive lift in the number of data transactions. So not just a handful of mega companies transacting on our data, but we, the people, a few billion of us on the planet, constantly transacting on our data in ways that are specific to us. If I'm interested in understanding what are the best ways I can manage my migraine, perhaps through meditation or yoga, today I can't ask that of AI in the traditional Google search engines or others. I really depend on a cohort of other women with migraines and have experience practicing different yoga and meditation techniques to figure out what works. Because fundamentally, we as individuals, we only have maybe a century of time on this planet. That's way too short for us to figure out everything we need to know for that century that we're on the planet. And one of the big gifts we have is that, of course, we're not alone. We have a couple billion of us all doing health differently, all doing their lives differently. And that puts us in a place where if it was safe and secure to capture that minutia of our lives, we would be able to answer very specific questions at every turn in our health journey in ways that would be highly reliable. And I think that opens up brand new business models for health providers and for payers, because they're not going to just transact on medications and procedures, but really transact at a much deeper level on individual data or digital assets, that they can verify that these are real people that had these real events and these are the real outcomes. And then that this is something that will be a huge lift in wealth production, because of course, as George Gilder taught us, all new wealth is built on the basis of new knowledge. And the volume of knowledge that could be generated if we, the people, pulled up our sleeves, rolled up our sleeves, and participated in co-producing that corpus of intelligence that all of us could use to live our lives by, that would be a massive lift in knowledge and massive lift in new products and services that would underpin the next revolution of wealth production. And so that suggests that a future whereby the data we produce on a regular basis could work directly for us as an economic asset. And that's something that the industry has taught us already, that health information is actually quite valuable in comparison to just browsing or purchasing behaviors. Health information is incredibly valuable and provides us with a way in which we may be able to have a non-taxation way of generating universal basic income. Perhaps we become our own CEOs of our own data banks, and that these data banks become an important part of the way in which we not only ensure that we can foresee health outcomes that we're not interested in and redirect our health journeys around those health outcomes, but also use that data bank to ensure we have access to at least a universal basic income of some nature.
Thank you. And maybe about 5 minutes more time to left. So Ari, are you there? Do you have any question or comment?
I've been typing most of my comments in. I'm a big fan of this vision and would love to see this come to life. And you know, it's really great.
Thanks, Ari.
Okay. I think that we can talk more and more, but because I because wondering, because this kind of the this discussion of the topic will be, I think that this should be the mainstream. Because recently I have a very concern about like how to make digital health as mainstream, and then I touch upon how to include adult whatever, but this kind of topic is very rare in healthcare, means they're still not yet, right? To adopt this kind of concept in the mainstream healthcare, right?
Well, I think it's becoming more and more obvious to the C-suite in healthcare organizations that
Hmm.
it's clear that people are actually going to produce more data themselves than what
Hmm.
exists in the EMR today. And the EMR was never designed
Hmm.
to hold the minutia of our lives. In fact, we the people do not want industry, governments, and others to hold the minutia of our lives. We need a different data structure to enable the future. But the big players, the big data players, the hospitals, the clinics, the payers would love to partner with us with access to that contextual data, that full context data that would allow for highly specific recommendations and new products and services that are, in a sense, the product market fit is built in that it was the market that declared that these products and services need to exist in the first place.
Hmm.
It's from the AI working on everybody's home base that's showing that these correlations matter. And so that means that we have a future whereby the industry is likely to benefit at least as greatly as individuals with a new data structure that allows this type of collaboration while protecting individual agency at all times.
Yes.
So think of Denmark. Denmark has a great study out that showed in Denmark they had data on their 6 million population up until 2016, so about a decade of data, and used their data from 2016 to 2020 to test their models. And their models showed that if you had very detailed contextual data around employment, education, wage, vacation time, etc., you could, to very tight parameters, understand survivability for the next 4 years. And so these types of early proof points are showing us that the opportunity to do a much better job in terms of delivering individually specific health intelligence to our population is just around the corner.
Oh, wow. Fantastic. I think that for example, today, I posted one interesting research about whether digital health can be a part of the like a precision medicine, and then the final conclusion was that it's too much U.S. centric, right? But I think that in a different situation, right, for the healthcare data and other things, I think that it's not like rather than it's U.S. centric, it's more global, right?
Oh
So.
yeah, totally. I mean, Denmark's ahead of us, whether
Right.
we were to
Even we are
say.
behind, right?
Mhm.
So,
Yeah.
yeah, so I think that that's a fantastic topic that we can think about more. Okay, so I share my LinkedIn post about my presentation, so you can download my presentation, and then you can because Brigitte is very famous, so you can find out easily her LinkedIn connection. So do you have anything to talk with her after this webinar? You can personally contact her, and then may hopefully we have another chance to have this type of the like event later,
Mhm.
right? It should be more frequently done. So right, so hopefully that this is the motivate that we can start this kind of series of this kind of discussion maybe in the future. Okay. Okay, so thank you, Brigitte, and share your great insight. It was a great honor to having you in our webinar. And then I thanks many participants, especially the Jim and Randy, to raise a very, very, very insightful question and interact with other people. Okay, so as I discussed, this recording will be shared in after our webinar. Okay, so thank you everyone to attend today's webinar. And then I hope you have a good time, rest of your good time, because don't know about maybe the beginning you are in morning time. I'm in afternoon, and somebody maybe in the evening. So thank you, and hope to see you in my next webinar. Thank you.
Great. Thanks so much,
Thank you.
Alex. Thank you,
Bye-bye.
everyone. Bye.